Thank you very much, Kathy, and welcome everyone. Yet again, we have a wonderful crowd, and particularly welcome everyone from all over Ireland and indeed from all over the world. So great to have so many people join us. I'm just going to move ahead sharply and introduce you to our key speaker for this morning, Professor Ian Robertson. Ian is an emeritus professor at the School of Psychology at Trinity College Dublin and at the Global Brain Health Institute. So I'll just move ahead, Ian, and let you go ahead with the presentation. I'll introduce the panel afterwards. Thank you.
Thank you. Thank you very much, Mary. And just to say thank you for inviting me to do this. It's a real privilege to talk to the frontline soldiers in a war against a dreadful virus. And, you know, we all depend on you. You're risking your own health by doing what you do. And just, I think that, you know, that feeling of self-affirmation that you deserve to make of yourself really is one of the great kind of bolsters against the stresses that you have to face. So I do, if you're moments of doubt or feeling overwhelmed of stress, just remember what a fantastic service you're doing, what a selfless service you're doing for the people you're caring for. And so really, people like me, really, we depend on people like you. So thank you very much. So I'm going to, in 25 minutes now, I'm going to talk about self-care. And this is I did this workshop with our Global Brain Health Institute fellows all over the world last night, and it was an hour and a half. So I've got 25 minutes. So inevitably it's compressed, but I'm hoping to give you some practical tips for managing this difficult, stressful situation. So there we go. So just as the objectives, I want to convince you that you have considerable control over the most complex entity in the known universe, the human brain. And I want to teach you some practical strategies where you can actually control that. And if you can control your brain, you can control your emotional state and your behavior. Not completely, obviously, but you have a tremendous potential actually to be master of your own emotional and cognitive system. And the third point is just to understand how stress actually, I'll be explaining to you, is actually a form of energy that can be harnessed for good. It's not always bad. So I just want to show you a picture from our scanner in Trinity of a very important part of the brain called the locus coeruleus. Now, this is the only part of the brain that produces a neurotransmitter, a chemical messenger in the brain called noradrenaline, which is an incredibly potent drug, and it's a natural drug in your brain that is produced when anything new happens or when stressful situations happen. And I'd like to just give you a little tip about how you can use your breathing to actually change the functioning of this part of the brain, which has very important ramifications, as I'll explain. So I want to start off now by asking you all to close your eyes and just take in, and I'm going to do this as well, and take in a long, slow breath for the count of 5, and then slowly out for the count of 6, okay? So let's do that, your own count. And now do that once more. Now, if we were all together in a room, I'd say, how many of you feel a little bit different now, having done that compared to before? And about 90% of you would put up your hands and say yes. So I'm assuming that many of you feel different now. The reason you feel different is that you changed the amount of noradrenaline that was being released by that part of your brain, the locus coeruleus. Because the locus coeruleus is chemosensitive. So it's beautifully, exquisitely sensitive to how much carbon dioxide is in your blood. And your breathing, your carbon dioxide levels in your blood go up and down with your breathing as you do so. And what often happens in moments when we're very busy or very worried or very challenged or very stressed is our breathing changes and becomes more rapid. Sometimes we even hold our breath. We find that we're holding our breath without realizing it. That changes the carbon dioxide levels in our blood, which changes the amount of noradrenaline in our brain. Now, the thing about noradrenaline is it's critical for our brain's smooth functioning. Okay, and if you have too much or too little of the stuff, your brain underperforms, and that's why sometimes when we're in a stressful situation or a worried situation, or we're downhearted, we can actually our thinking can be muddy, and when our thinking's muddy, it means it's harder to solve the problems, to deal with the situations we're dealing with. So I just want to give you this. Probably the most important tip, one of the most important tips you'll get in this session, which is use your breath to change your brain. And I'm going to give you practical advice on exactly how to do that, okay? But I want to just quote Tiger Woods, the golfer. And Tiger Woods says, "The day I'm not nervous is the day I quit. It's the greatest thing about it just to feel that rush." So there's a strange thing. He conceives of stress, nervousness, as being a positive. In fact, he needs it to perform. In fact, all great athletes need an optimal amount of stress in order to have their brain performing at the right level, okay? So why would that be? Well, let's look at these symptoms: fast heart rate, sweaty skin, dry mouth, churning stomach, tense muscles. Ask yourself, what are these symptoms of? And if we were together in a room, people would say anxiety, mainly. But I had these symptoms last year, a few months ago, and I wasn't anxious because Ireland had just beat the All Blacks at rugby. So I was excited. So how can it be that the same set of symptoms are there for two completely different emotions, anxiety and excitement? Well, the answer is that this is a non-specific, these symptoms that we tend to call stress are actually non-specific preparation of the body and brain for action. And the body and brain don't really care what kind of action it is, whether it's running away, flight, or fighting off someone, fight, anger, or celebrating, excitement. So this is a non-specific action system, okay? So it's this action system that Tiger Woods uses in order to get optimal performance in the brain. Because they're all symptoms. These are all symptoms, yes, of anxiety, but also of excitement, also of anger. In fact, they're all general arousal of the body's brain and autonomic nervous system and bodily system to prepare us for action. And there's nothing specific about that action. So you ask yourself, how then do we know what emotion we're having if the symptoms in the body are the same? Well, the answer to that is context. I only knew that I was excited and not anxious a few months ago because I was sitting with a beer on my sofa watching a game. Had I been in some other situation, I might well have interpreted these symptoms as being symptoms of anxiety, and therefore I would have created in my mind the emotion stress and anxiety. Okay? So we only know what emotion we're having by the context, not by the bodily symptoms. And here's the wonderful fact: we can create our own context using our own brain functions. So let's think of some stressful situations that you as carers and professionals and working in intellectual disability services, here are some of the stressors that you can, going through the fear, fear of an outbreak in the place you're working, the sense of guilt if there is an infection, did I do something wrong? The emotional toll of you being the second family because of all the restrictions, and that relentless day-to-day work you're having to engage in. And then these interminable Zoom meetings that we're all having to do. There seem to be many more meetings than there were before somehow. And then the grief and the challenges of dealing with death and dying, the responsibility, the helplessness and the hopelessness. And then the real cruncher, when is this going to end? So these are just examples of some of the stresses that Mary tells me that Professor McCarran tells me that you're encountering. I know there's many more. So let me just go back to this little funny locus coeruleus in the middle of your brain and the noradrenaline it produces. So this is called the Yerkes-Dodson curve. And this is a fundamental feature of the brain, which means that this is the amount of noradrenaline released by your brain. So arousal is along the bottom, and how well you perform is up the left side there. So when we are jaded, bored, burned out, sleepy, 4 o'clock in the morning, we don't have enough noradrenaline in our brain to perform well. Because noradrenaline acts as a kind of lubricant in the brain. It helps the different parts of the brain to resonate together at the right frequency, and so we get clear, smooth thinking when we just have enough. But then there's a situation when we're trying to cope with all the demands and work, there's worries about an outbreak, trying to deal with all the new PPE regulations, everything like that. Then we have too much of the stuff, okay? And that also, too much of the stuff means our brain doesn't work properly. So we need to try and reach the sweet spot in our brain function, particularly in stressful situations. In the workshop yesterday, colleagues were telling me that surgeons in Holland are taught how to use this breathing method particularly to apply when they have surgical emergencies, when something goes wrong during surgery, that they, in order to maintain clear thinking, they are taught and they practice in advance this breathing in order to bring their noradrenaline levels, which are too high in the stress, back to the sweet spot where the brain will perform better. And if your brain performs better, you can remember better, you can think more clearly, you will be able to solve the problem you're facing. It won't seem so overwhelming. And that will bring your stress levels down, but also help you to behave more adequately. And that then takes the stresses off you as well. So here's my tip for practically. So you've got busy days, all of you. You're doing different things. You're writing a report. You're making a phone call. You're having a meeting. You're dealing with a client. You're doing all these things. Try and get into the habit, and you can do this at home as well. Try and get into the habit of every time you change task from writing that report to going to see a patient, take 20 seconds, just 20 seconds to reset your brain chemistry by doing that breathing exercise we just did. Breathing into 5 and out to 6. Just that little reset will just an antidote to your brain going into a kind of stress mode of thinking. Okay, excuse me. So here we have a second thing, how to turn stress into challenge. Because I explained to you that we only know what emotion we're having by the context. So we can change the context. We have the most complex entity in the known universe between our ears. So one way of doing that, if you're faced with a very challenging situation, so supposing, a client who's, very, very sick and there's not much you can do except care for that person, or a difficult interaction with relatives over the phone, or complex frustration with some bureaucracy you're having to deal with in terms of urgent things you need. So these things can all stress us, and sometimes the stress is not changeable in the external world. The bureaucracy, there's some things that there's nothing you can do to change it to reduce the stress. You can't do anything about the client who's very, very sick and maybe going to pass. So what do you do then? How do you reduce that stress? Because stress is a perception. Stress is the perception that the demands made on you exceed your abilities to cope with them. And the resulting emotion is anxiety. And anxiety, as we saw, disrupts brain function. So one way that I've stumbled upon is in a situation where you can't change the external reality, you can define the goal for that situation in such a way that you get a sense of achievement and satisfaction. So you can make the goal an internal one is I am going to behave coolly and compassionately in this situation. So someone may be shouting at you down the phone, very angry with something about, a client or some colleague may have. So the natural response when someone's angry with you is to respond in kind. But if you set yourself, and that's a stressful situation you may not be able to change in the external world. But if you change, so imagine you're anticipating that situation happening and you're getting very aroused, you're getting anxious and angry in anticipation. If you set yourself the goal is I am going to behave coolly, I am going to behave with empathy and compassion for this angry person. My goal is not to respond in kind, but to respond in a counterintuitive way of calmness and professional cool. Now, I'm not very good at that. I'm a kind of impulsive kind of person. But I have learned to do, I can sometimes do this, sometimes I fail. But when I do this, and I have done this in the past, even though the external situation has not changed, there's no sense of achievement because I've managed to solve that problem, because it's a problem that can't be solved easily in the world, or at least I can't solve it. I've changed my goal to be an internal goal, that I am going to behave in a way that goes against the grain of my kind of irritable, impulsive personality. And that gives me a huge sense of achievement. And that's very, very important, because that's me reimagining a stressful situation that I can't control as a challenge rather than as a threat. And that, together with the breathing, is the second most important thing you can take away from this situation. It doesn't apply only to work. It applies to your whole personal life as well, of reframing in your mind, using the power of the human brain to reconceptualize a stressful situation as an opportunity to perform rather than as a threat. Okay? So that's what's happening here. Here we have the upside down U-shaped function of the noradrenaline curve, the one that you can affect with your breathing. What happens when we're at the right side of that curve? We're in a state of stress and anxiety, and when we're in that situation, we get anxious about the anxiety, and that makes it even worse. So it's a vicious cycle. So if we can do what I described, turn that awful conversation you're having to have with someone into an opportunity for you to perform against an internal goal, what that does is it changes the context. It changes it from the anxiety, potentially, there will be still some anxiety, but it changes the emotion from one of an opportunity, a threat to you of humiliation, of being, of all sorts of threat that comes from an angry confrontation, to one of challenge, of one of opportunity for you to perform against an internal goal. And that will pull your noradrenaline levels back to the sweet spot. And in that situation, you'll be able to think more clearly, you'll be able to remember better, and you'll be able to perform better. That then will also reduce your anxiety. And this is the way the brain works in a very crude way. So basically our lives, every aspect of our lives, is the outcome of this primitive struggle between two forces. The anticipating of rewards, the approach, the going forward, the anticipating good things. On the one hand, let's call that the approach system on the left, and then the fear of consequences, the fear of negative results. So you might think, for example, will I go for that new job? And so there's all the thought, oh, better pay, maybe more interesting, advancing in my career. That would be the approach system. Then there's the negative one. Oh my goodness, imagine I go, imagine it closes down. I might not like it. Maybe I won't be able to do it. So that's all the avoidance system. So the approach and avoidance, all mammals, in fact, all animals have this conflict between approach and avoidance. And our lives are a balance of that. And the thing about these two parts, these are to some extent laid down in the two halves of the brain. So our two halves in the brain are in a struggle with each other. They're inhibiting each other all the time. So if we get in a very anxious state, where we're in that anxious state, the right half of the brain there starts to dominate and inhibit the more positive aspects of going forward, optimistic, goal-seeking behavior. And it becomes, in that situation where we're dominated by anxiety, difficult to imagine good things in the future. It also becomes difficult to remember good things in the past. Our whole memory and attention systems become biased to negativity. That's called the negativity bias. And in that situation, our mood goes down, our anxiety goes up, and our thinking becomes unclear. And so what we have to do is to try and restore that balance. It can happen the other way as well. I'm sure we've all worked with people who are overconfident, who are dominant, who are maybe selfishly focused on their own goals the whole time. For them, the left hemisphere system can overtake. That's related to another neurotransmitter, dopamine. That can overtake, and that's what happens in compulsive gambling, in people who get addicted to power, sex, cocaine, money. You can get that, and when that system takes over, it squishes the right hemisphere system, so they get less anxiety, they get lower self-awareness, they get lower empathy. I mean, and you know, President Trump would be a classic example of someone whose approach system is just completely dominating his avoidance system. So your challenge in managing your own self-care is to get in the balance, because we don't want either of these systems to be dominant, because we need to have risk perception. We need to be aware of the possibility of bad things happening, but I need a balance, and it's very easy for the brain to get out of balance. So here's my third tip for you today. That is, and this was a beautiful study that was done in America. I won't go into details of it, but basically, if you're in a stressful situation, having to present, in fact, do mental arithmetic in front of an audience, and if you say, I feel anxious before you perform, compared to changing one word there to say, if you say, I feel excited, just saying the word excited, I feel excited, had people perform better on the task, on the mental arithmetic. Why? Because they had magically changed the emotion from anxiety to excitement, from threat to challenge, by conceiving of as this an opportunity to perform as a challenge. And when you do that, it pulls you back from nearer the sweet spot of performance. Now, here's a lobster. Here's a problem for you. How do lobsters grow? Because their shells are fixed and hard, and they're soft and growing inside. How do they grow? Well, the answer is they grow because it gets really painful and uncomfortable as their body grows, rubbing up against the sharp interior of the shell. What do? They, in desperation, find a rock to crawl under, and they then squeeze painfully out of the shell and wait there, vulnerable and I presume, don't know if lobsters can get anxious, but anyway, certainly vulnerable under a rock, and slowly wait for a new, bigger shell to grow. And a lobster will do that 6 or 7 times in a lifetime. So this is my, not my metaphor, someone else's metaphor for, if you like, the role of stress and adversity as an opportunity for growth. Because this is what we all have to do periodically in our lives. Sometimes we have to find a rock where we have to go under and then try and regrow a new outer layer, if you like. And this is not Pollyanna thinking. There's good science to it. The evidence is that people who grow up with too sheltered, no adversity upbringing, never ever, you know, the golden boy or girl is always does well and everything, never has any adversity, nothing goes wrong in their lives, they end up more emotionally vulnerable as young adults, more likely to be in low mood and low quality of life than ones who have had moderate levels of adversity, who've had rubbed up against some of the hard surfaces of the shell of life. That's not true for severe adversity. Too much adversity and severe adversity has negative effects just as much as too little. So here we have another upside down U-shaped function. So the evidence is that emotional toughness, resilience, is developed like a vaccination, if you like, but also pain tolerance. When these people who have had very little stress in their lives or adversity in their early lives, if they get lower back pain as adults, they're much more likely to be off work long-term on severe painkillers and disabled. And also there's evidence for people in their 70s who have moderate levels of stress, I mean, not nice levels of stress, actually seem to maintain brain function longer, better, partly because having to deal with the stress increases noradrenaline levels, and noradrenaline levels has at the right level has very positive effects on brain networks and acts as a kind of brain fertilizer. So here's another fourth tip for you. Consider moderate stress as a form of vaccination and a source of resilience. This helps you get into the challenge mindset. So rather than saying, oh my God, this is terrible, this adversity is awful, seeing it, saying, okay, if I get through this, this will strengthen me. I mean, Nietzsche said that, what doesn't kill me makes me stronger. And that's true within limits. So I just want to, Mary, how long have I got? 2 more minutes?
2 more minutes, yeah.
Yeah, okay. So just for goals, great Harvard psychologists showed that successful people set moderate goals for themselves. Emotionally well-adjusted people and people who are successful in their own lives, that's not defined objectively but subjectively, are very good at chunking their time and setting goals and getting a sense of satisfaction of goals achieved. And that's, you can actually change the chemistry of your brain in another way. The dopamine system of the brain, the reward system of the brain, the feel-good system, we only have one reward network in the brain. If you structure your time so that you create small goals during a day or during a week or during a month, where you're clear about what it is you want to achieve, and it may be just finishing that report or having that difficult conversation. If you are clear about your goals and you set your goals and you know if you've achieved them, you will release in your brain a network of neurotransmitters that are equivalent to an antidepressant and an anti-anxiety drug. So you can control your own pharmacy of your brain. So here's my final tip: contrive small successes. Thank you very much indeed.
Thank you very much, Ian. That was a wonderful presentation, and I know that we could have continued to listen to Ian for a lot longer than 25 minutes. And thank you, Ian, for keeping to time and pushing that really, which was extremely helpful presentation, and hopefully to everyone. I'm just going to now introduce the panel members. Thank you. Professor Ian Robinson will be with us, and he will join the panel, so thank you for that. Deirdre Rudden is Director of Human Resources at the Daughters of Charity Disability Services, and the Daughters of Charity have been very much to the fore in helping us to push these webinars, so thank you, Deirdre, and lovely to have you this morning. Caroline Dench. Caroline is a clinical psychologist with St. John of God's, and Caroline gave a previous presentation, so you're very welcome, Caroline, and thank you for that. Dr. Niamh Mulrine is a clinical director, psychiatrist at the Daughters of Charity Disability Support Service, and thank you, Niamh, for joining. Professor Sean Kennelly is a professor geriatrician at Tala University Hospital and also at Trinity College. So thank you, Sean, and for all your input over many webinars at this stage. And also to Bridget Murphy. Bridget is from the HSE and is a regional nurse manager in the HSE. And thank you very much, Bridget, for joining us this morning. And also, of course, just before I finish, I really do want to thank Kathy Payne, Dr. Kathy Payne, and Karen Carnley for all the support with these webinars over time. I'm just going to move, Ian, and I'm probably following up with a question from your presentation. And one of the issues often for staff is managing the work, and then issues for people who have also family at home, and the stress and worry of bringing home perhaps COVID to the family, and managing the tension, particularly for frontline workers, between work and home.
Yes, that must be a huge source of stress. So the two things I would say about this. One is you're not supermen and women. So you have to just do your best. And then there's a certain point where you have to be fatalistic. And I call that strategic fatalism, where you do your best, you control what you can, but at a certain point you say, look, Allah will decide, whether and it will do no good for me to anguish and be anxious about that. The second thing I would say is every time we're doing something, whether at home or at work, we should always have two goals. We should also have always have a shadow goal. We have our main goal, doing what it is we're trying to do. But the shadow goal is monitoring our level of anxiety and I call it frazzle. So we have to constantly, repeatedly monitor what our level of frazzle is. And if we find we are going into the frazzle zone, in other words, you're not going to think clearly, you're not going to remember clearly, you're feeling overwhelmed, you have to switch off from the goal you're doing. It doesn't matter how, whether that goal, how important it is. You have to go and get yourself back to the sweet spot. So you have to switch to the goal of looking after yourself and getting your brain back in a state so that you can actually perform the original goal better. So that's why self-care, moment-to-moment self-care, so that all hell is broken loose at home. There's, things are not happening. Sorry, I'm just going to have my priority at the moment. I have to get my head back into the right state so that I can perform.
Yeah, so it's a deep breathing. Thank you very much for that, Ian. And a second question, particularly there's many shift workers, of course, working in the system. And this business of people transitioning from day to night shifts, and where they're, even maintaining a healthy nutrition and diet during that period, and maximizing daytime sleeping. So this is people who are shift workers within the system. Any hot tips for them?
Well, I mean, that's a really challenging one. I would just make two suggestions. One is the value of naps. Sometimes if you can do a 20-minute or less nap, so you may have slept for 4 or 5 hours in the morning, but sometimes there seems to be evidence that if you have naps that are short enough that you don't go into deep sleep, they can have an incredibly refreshing effect. So if you can, you may have slept for a certain amount of time and after coming off the night shift, but even if later in the day, if you can find the time to have a 20-minute nap or a 25-minute nap, that can be one way of undoing some of the hangover of the nighttime working. And the other thing is having a method like mindfulness or some meditation or some yoga or some way of just stilling your mind, of going into a state of relaxation. And there are many different ways of doing that. If you can do that, that is incredibly healing for the brain as well, and can help undo some of the negative effects of sleep loss.
Okay, great. Thank you very much for that. Okay, Deirdre, I'm just going to move to you. I think one of during this crisis, we have seen huge need to redeploy staff from one area to another. This has happened in the general hospital systems, where we have moved people from perhaps X-ray and outpatients to ICU areas. So this can be extremely stressful for people. And a number of questions have come in really around the stress that this is for people. It's a huge learning curve, bringing anxiety and bringing stress. And people feel, well, while people listen, people are very busy. And have you any support or any hot tips that you might give to staff who are feeling this and to organisations?
Yeah, I mean, it's a major issue that's happened in our service. We've redeployed at least 150 staff, and anxiety that staff feel in those circumstances sometimes can feel diminished by the bigger issues that are going on in terms of the environmental issues currently. Um, it's really important to say thank you. It's really important to say we couldn't do it without you. The assimilation is key within those teams in terms of transitioning maybe from day to residential. And one of the things that we've been doing is around the communication piece. So it's really important that the staff feel part of the new team that they become part of. It's something we started mid-March, and the assimilation has been really successful. But I would remind those staff as well, remember the skills that you have. You bring those skills with you, and that is so beneficial to the organization. Sometimes staff forget that the skills that they have because they're in a new environment. So it's important to validate those. Communication is really, really key. It's something that we do with the service managers regularly in terms of feedback. But a major thank you to everyone, because change is always hard. And these changes and our expectations are huger than ever. But it's always important that people feel you can pick up the phone, you can ask a question, and it's okay to say, I'm finding this difficult. You know, that's still important to hear and to validate, and to continue on through that.
Yeah, I think that's very helpful, because it is that piece about validating how somebody is feeling within the situation. Sean, you might want to comment on that in the context of the general hospital setting. Your mic is off.
Yeah, I mean, I think exactly as Deirdre said, it's really just about that flexibility. I liked Ian's comment about, almost, getting to a conscious state of fatalism, whereby you realize, look, you just do your best, and you realize actually you have put everything into it, and that, everybody around you is working in an extraordinary scenario, and it is, I mean, there is, I would have always been very proud of the colleagues that I would have worked alongside, but never more proud over the last few months when you see how everybody has moved. And I think that's a common sentiment that lots of people have expressed. So that validation that you also talked about, Ian, is something that I think has been far more clear. So while it has been a very tumultuous time, there's been so many episodes whereby you've just seen extraordinary things happen and people do extraordinary things, that actually there is a reasonable balance and check system, whereby you can find the positives if you go look for it. But, and I think it's to consciously look for those positives, as you said, Deirdre.
Yeah. So. Okay, thank you very much. And Deirdre, and it's probably, I'm asking you, Deirdre, and Ian might want to come in on this, but sustaining employees' well-being during this prolonged pandemic, is there materials, and I know, Ian, you have spoken about some of the techniques, but is there something maybe that we can put up afterwards that we could share with our participants? Deirdre, I'll ask you that first, and then Ian, you might want to come in.
Yeah, I think that there's a lot. Again, it's about the communication and getting it out there. It's also about normalizing the environment that people are working in. COVID is here, and it's going to be here for a long time, certainly in residential settings. And it's really important that we accept that, so that the fear is removed in terms of everything we're doing are preventative measures in order to control the environment as much as possible for staff. So every measure, every memo that we've sent out is about, here's what's going to happen next, here's why we're doing it, and here's how it's going to support you and protect our service users. So that's really key. I think little things. We do a thought of the day every day. I try and incorporate different things, maybe a poem or maybe a piece of art. We sent out a link yesterday for mindfulness, which relates to images in the National Gallery. So it's to go online, take a few minutes for yourself, look at the images, and just take yourself out of the environment that you're in. There's a lot of, we sent out some data on kind of controlling your stress. There's some really good website links in terms of, again, around mindfulness and resilience. We're also working with our psychology department in order to ensure that, as well as EAP, there's in-house supports there if necessary. And those are things that we will continue to do, because we will continue to change as, you know, the pandemic continues, and we'll need staff to continue to adapt. So it's the forward proactive communication, and always ensuring that what we're doing is controlling the environment as much as possible in a positive way.
Thank you very much. I don't know, Ina, do you want to add anything to what you?
No, I think that was perfect. You know, the resources that you described there. I don't really have anything to add to that, Mary.
Yeah, lovely. Thank you very much. Thank you, Deirdre. Caroline, I'm just going to ask you a couple of questions that have come in, and one of the I suppose the trust of intellectual disability services very often is that there's long-term relationships between staff and the people that they're caring for, service users, and with families. And, you know, we have heard a lot about statistics and numbers that have died, but there's very deep relationships with people. And their staff often are nearly like a second family, as I've previously mentioned. And just this whole issue of disenfranchised grief. And have you any tips that you can give, or any advice around that, or how you're dealing with some of those?
Yes. Thanks, Mary, and thanks, Ian. Wonderful presentation. Disenfranchised grief is grief that's generally understood as grief that's not openly acknowledged or socially accepted or even publicly mourned. So for staff then who are still working and bereaved, it can have an impact on their emotional, I suppose their emotional well-being, their physical well-being, their spiritual and psychological well-being. It's a very personal experience. It can be quite intense. People experience it very differently. So not only are you thinking about and experiencing these feelings of loss, but there are also maybe feelings about the decisions that were made or not made in the context of COVID-19 that may be relevant here and very real for the staff and the staff team and the family. So there's a lot to be considered with disenfranchised grief. It's a very healthy and normal response. So when someone dies that you've not only cared for, but actually cared about. And what we're finding is a compassionate, flexible and very sensitive approach is required. And it needs to be individualized for the person. And that can come from colleagues and managers. This will help in the immediate aftermath of a bereavement, but also in the long term, because we are going to come out of COVID-19. We are going to decompress and need to be able to reflect together. So it's very important that our responses are sensitive and not in a hyper-aroused state. So when we're thinking about that, we want our healthcare worker to continue to feel valued and for their feelings and responses to be valued and understood, using reflective listening, supporting the person to tell their story. There's also very practical things that we can think about, and it goes back to actually kind of what can I do at the moment as opposed to what can I not do, and that goes back to setting kind of small goals. So how might we support somebody to lead on books of condolences, to think about how to commemorate the person with the family, how to cry together and how to laugh together, how to think about sharing memories, how to participate in the funeral, just given all of the restrictions around the funeral and the rituals and routines in death and dying. How might we mark some key dates? So the other thing, I suppose, for somebody is to think together around whether I can cope with this, or is this grief and bereavement overwhelming to me? So is there additional support needed? So if, for example, a healthcare worker's sleep is being affected, if their concentration is being impacted, their decision making, as Ian was saying, their brain's just gone a little bit fuzzy. It would be important for the line manager or colleagues and the healthcare worker even themselves to actually say, I'm not okay at the moment. And as Deirdre was saying, it's okay to say that you're not okay. The other thing I think is, don't forget about our end-of-life care policies. Many of our organisations have excellent end-of-life care policies that do look at and consider safe relating when somebody is dying. So how we participate in somebody's end of life is really important. And we are thinking about safe relating so that people don't feel isolated and don't feel excluded from somebody's end of life.
It's okay. That's very helpful. Thank you, Caroline. And I know we have had a previous webinar where we really looked at the people in isolation, but again, we have had questions that have come in from some of our participants. And I suppose it's nearly, it's the issue, the stress or anxiety sometimes for staff members, knowing that the individual themselves perhaps misses the family so much, but also that the family misses the individual, and the staff is here, you know, trying to support both groups.
Yeah, this is indeed a challenge because the emotional toll you're describing, it's not just about how to support the people that we are living and working with at the moment, but this is also very pertinent in our own lives because we're all actually missing seeing our family and friends and even elderly parents and relatives. So I suppose this is transference, isn't it, and counter-transference, because we're actually all in this together. And I think the important thing is we're all actually doing our best. And many of the people we're supporting are actually coping very well with the new routines and the new methods of contacting and even the new modes of contacting. So I'm hearing about people using WhatsApp to watch the soaps together. I'm hearing about virtual tea and cake in the afternoon where everybody sets the table and everybody's having tea and cake together. And also, I suppose, around capturing some of the wonderful moments that are happening so that people can share them with their friends and family members when they are using technology to actually connect. So it is really important to note that there are lots of wonderful connections actually happening day to day. But for a very few amount of people, this loss of contact and this change of contact is causing distress. And services are looking at ways to reduce this distress and using ways that are pragmatic and proportionate. So for example, can a person be supported to drive to their grandparents' house and say hello to their grandparents from the car? And we're really thinking about, is that essential? And for some of the people we're actually supporting, the answer is yes. So we are beginning to think about essential in the context of maintaining well-being and reducing distress. Healthcare workers and family members are actually creatively problem solving together at this time with people where they're finding it very, very difficult within the guidance being provided by the HSE. And I suppose just to kind of echo a lot of the panel's comments there, that people's gratitude journals to themselves should really be bringing over at the moment because people are doing wonderful things.
Great, thank you very much, Caroline. And next week we will have a webinar exactly focusing on the creativity, resilience and innovation of people with intellectual disability and the caregivers throughout Ireland who are putting that together at the moment. So that would be lovely to share across the country and with our colleagues internationally. Thank you, Caroline, for that. Niamh, I'm just going to move to Dr. Niamh Mulrine. Thank you, Niamh. And this is a question that has come in. If you can't cope with being isolated with a service user, should you step back from the job or from supporting that person?
Okay, that's, I think, brings up many issues for people that are working in services. I mean, many of us are working in situations that maybe that are unfamiliar to us, that a few months ago we wouldn't even have considered ourselves being in. And many staff have been redeployed across services, and they can be working with supporting unfamiliar people, with unfamiliar teams, unfamiliar line management. These are all difficult things for people to deal with, but we've seen how they can be reframed, how we can look at the kind of at how this can work through building resilience in teams. I suppose if you could step back and examine objectively what's actually going on in that situation, as if breaking it down, there could be a few possible areas that something can change. You as a staff member, are you bringing something into work from home, from your general situation that's making you more stressed, less able to manage in the workplace? Do you feel there's a mismatch between your skills and the person's need that you're supporting? looking at the environment, I know that at the moment, due to people living in different arrangements, that environment can be an issue. But is there a misfit between the person's needs, the environment, and how you can support them safely and optimally in that situation? We're not living in a perfect world at the moment. We all realise that, but we are really trying to do our best. And for the person that you're supporting, is there a particular thing that you are identifying there, something that is a need that isn't met, that maybe with a bit of creative thinking can be met? We have to remember that people are often working in situations in which they are the new pair of eyes in that situation. They may see something that people that have been working in that situation for many months beforehand may not have seen. They may see something different. So I suppose it's important to sort of to have that objective viewpoint, to step back and identify where are the particular issues. Having done that then, and having identified those, we're now, as I said, communication is so possible. Deirdre has really brought that point out. You need to escalate those things that you've identified to your line manager. It may not be someone that you're familiar with, but as I said, we are all trying to be really, really open and supporting the communication at this time. It can be that when you escalate and have that discussion around what's going on, that mitigation can come in there. Is it a case of actually looking at some minor changes in the environment? Is it that you finally identified there's certain things that maybe that you can do to bring down that feeling of not being able to cope in that situation? Or is the person that you're supporting, that you've identified something for them that can actually make a fundamental change for them? Ultimately, we're in a period of change, of uncertainty, but you know, this too will pass. We are in a situation where we're sort of at a sort of interim phase of supporting people. We've had lots and lots of information coming at us over the last kind of nearly 2 months at this stage. And now we're sort of at the stage of, well, how can we hold this? How can we support things? How can we improve, given what we are facing? How can we improve and how we manage for the next while, which again, it's an uncertain timeline. Recognizing that is important. But as I said, there are reframing, look at the positives. You're in a situation perhaps in which you can bring new insights and new benefits to the people that you are supporting, but communication is vital.
Yeah, and I suppose as well, if somebody is supporting somebody in isolation and it is just too much for them, it is so important to discuss this with the line manager and look for support and reducing perhaps the amount of time or shift works or getting breaks or periods during that day if you're with somebody who has intensive support needs. I think
Absolutely.
it's important because very long shifts and working with somebody with intensive support needs can be overwhelming, and we need to be creative in some of those issues. So thank you so much, Niamh, for that. I'm going to move to Sean in the interest of time, Professor Sean Kennelly, and you probably have experience of this in the general hospital system as well, but some of the issues within the intellectual disability system is nearly the stigmatization of COVID-19, I suppose, in a way, and the fear that if there is an outbreak that staff are self-questioning, was it them? And I know Ian has touched a bit around this, and I just want to ask you your opinion on that, and is this something that you see perhaps with the nursing home sector or another sector?
Yeah. So as you know, Mary, this has been something that I've been talking about quite a bit for the last few months because I think it's really important. There is no stigma attached towards having COVID-19 come into your residential care facility, or somebody that you're looking after getting it, or you getting it. This is very different to other infectious disease outbreaks that we would manage. And I suppose that's the thing, is oftentimes people will draw back on their experience to things like, you know, MRSA or CPE infections and things, and they start associating with, you know, my facility is not clean, or I'm not doing enough to restrict visitations. This is totally different. We're in a global pandemic. This virus is extensive within the community, and in many respects, that's why it's proving so challenging to mitigate it in the first instance and then eradicate it. What we also know is, and I think is very important for this, is the asymptomatic carriage. So when this was coming out of China, we thought maybe 2% of cases were accounted for by asymptomatic carriage. By the time it got to Italy and we started looking at the Italy figures, we thought maybe 5 or 6% by the time it got to Italy. And now we're looking at least 30% when we're looking at doing the widespread swabbing screening that we're doing. And many of the people online today will be involved in those screening programs. And we're identifying 25-30% of asymptomatic carriage between staff and in residence. So we know that there's a huge asymptomatic profile with this virus, which means there's very little that anybody could do, and there shouldn't be a sense of responsibility. And I think the danger of the stigmatization of it is that it makes people reluctant to come forward and look for help. And that's the real risk. I keep on saying we need to know early if people are under pressure. We need to know early if there's case. We need to have a really low threshold for case identification. So in people with cognitive or intellectual disabilities, it's about you are the best people who will identify if they're not themselves. And if they're not themselves, that is often the first symptom of COVID. And to have that low threshold in those facilities so that we can get them tested and get the results back and try and mitigate any spread. So we have a very, very low threshold for suspecting it and a very, very low threshold for asking for help is what I would say.
Okay, thank you very much. Thank you, Sean. Okay, Bridget, I'm going to move to you. Thank you, Bridget Murphy. Bridget, one of the things obviously that is ramped up now is the increase in testing. And there is a concern that that we will just simply not have enough nursing support, and that this isn't in a hospital, and that somebody may be, if they're in a group home or in a residential centre, that they may be more on their own. And there's a big concern over the additional testing and just not having enough staff now to cover.
Yeah, I think the first most important thing to do is acknowledge those concerns that staff have. It's genuine. People are working geographically, remotely in community homes. They're not big acute settings, and it's a very real fear that staff have at the moment. I think to make sure that there's a forum there for those staff to communicate with their colleagues, whether it be in another home within your service or within another service, to provide that forum for them, whether it's IT facilities or contact details for those people. I think to have staff in a lone working situation, to assure them that there's extensive support there, that this is a public health issue and there's an array of supports available, to assure them that management, every centre at this point, will have a contingency plan in place. Those services, whether they're HSE or Section 38 or 39 agencies, will all be supported by both, say, the crisis management team from a HSE perspective, the residential support response teams. They're all made up of members, the disability managers, people who know the services. There's a huge amount of work going on in the background in relation to identifying staff that will be available to go into services in the event of a large number of staff becoming unwell or being recommended to go into self-isolation. There's redeployment pools, there's volunteers being selected, student nurses are being appointed as HCAs, there's internal redeployments, as some of our colleagues have just made reference to, and all of these people are undertaking, being prepared for supporting services. So they're undertaking the online training, they're reading over all the guidelines. I think again for staff in those lone working environments to keep that line of communication open, to make sure that they're informed of what's going on, that you're open and transparent with them in relation to the resources that you have, the plans that you have, maybe reconfigure your rosters, to look at the preventative piece. So in the event that we do have a positive, how can we minimise the number of positive contacts that we have in order to minimise the impact of the effect on the service? So to try and prevent that lone working piece.
Okay, thank you very much. And finally, there's a further question in relation to the whole area of PPE and the stress that particularly if PPE has been sent per guidelines, but staff working in a particular area, that's not what they or how they have interpreted or perceived the guidelines. So people are looking for, what reassurance or support can you give to staff to alleviate some of the anxieties, particularly around what PPE to wear and when to wear it. It's just been, yeah.
Again, Mary, I think a lot of around the PPE, especially I think since last week, since the guidelines changed and the recommendations around staff wearing masks, I think has heightened the level of anxiety in staff throughout our services. There is that genuine fear from them that the supply won't be there to meet, you know, what their perception is. Again, preparedness, I think, educating staff, making sure that they have completed the online training so that they're fully educated in relation to what do I really need to do to keep myself safe. Keep them informed in relation to the supply and the demand. So if there are genuine problems with the supply of PPE, be honest with staff. Come up again, try and look at contingencies, look to other resource pools. Don't ignore, I suppose, those anxieties that staff are having, because it won't, you know, it tends to consume their working day rather than allowing them to carry on and support the very vulnerable group of residents that they're working with. So I think, you know, educate them around the supports that are there for them. Once they're educated, you know, refer to HICWA, the support group that's been set up, you know, by the Office of Nursing and Midwifery Services. They're setting up a shared learning through WhatsApp. There's mindfulness training there. I think if services, even the HICWA self-assessment framework, if each service and each staff member was to have the framework, you know, complete that self-assessment tool, look at the areas in relation to PPE that are causing challenges, and come up collectively with a response to that for staff. And I think if that transparency is there with staff, it will certainly, you know, alleviate some of the stress there.
Thank you very much, Bridget. And I know we had somebody, Gary from Kiernan from HICWA, who did a presentation, and there is an online hub and helpline through it as well for that. I'm going to just want to say a sincere thank you to all of the panel members. Particular thanks to Professor Ian Robertson for a wonderful presentation. It was really, really helpful. And I'm going to now hand back to Dr. Kathy Payne. Thank you.